Cosmetic surgery and plastic surgery are terms we are well aware of in today's world. The global cosmetic surgery market is so huge and steadily increasing. Will you believe me if I said these procedures were existing in India way before even the birth of Christ, approximately around 2600 to 2800 years ago? Today we have a specialist for eyes, another specialist for cosmetic surgery, another one for ortho, and different doctors for every part of our body. But there was a man who was all in one and transformed the landscape of medicine forever, who understood every part of the body, knew how to treat each of them individually, and invented different procedures for the same. And you know what? I'm not at all exaggerating. Did you know the first plastic surgery in the world was performed by an Indian surgeon whose name was Sage Sushruta? Every time I read or hear of this person, the knowledge and his dedication towards his art of medicine, I would get goosebumps. I really had been waiting for so long to talk on this topic, on this particular person. Hey, hello, bonjour. Welcome to Entailing Tales with Sush. Ayurvedic medicine is among the oldest medical systems in the world, dating back to the Vedic period of India around 5000 BCE. It was practiced in India for centuries before the Greek physician Hippocrates, known as the father of medicine, was even born. It definitely takes brilliance to accept the fact that India was way ahead of its times in the field of medicine, science, maths, history, literature, and what not. A tree's beauty lies in its branches, but its strength lies in its roots. It gives me great pleasure in talking about the achievements of one of the finest teachers in our surgical heritage, Sushruta, who is proudly known as the father of Indian medicine and father of plastic surgery. Around 2600 years ago lived a sage named Sushruta in the ancient and chaste city of Kashi, which is today called as Varnashi. In those days, intellectual people were called as sage or maharishi. The definition of an ideal surgeon, according to the great surgeon Sushruta, is a person who possesses courage and presence of mind, a hand free from perspiration, tremor, less grip of sharp and good instruments, and who carries his operation to the success and advantage of his patient who has entrusted his life to the surgeon. The surgeon should respect this absolute surrender and treat his patient as his own son. Sushruta, who did his work with love and affection, invented a scientific skill like surgery, which was a new concept in those times. Along with inventing surgery, he realized he'll need several surgical instruments, and necessity was the mother of all inventions. Keeping these necessities in mind, he developed and invented 121 surgical instruments, including needle and scalpels, that are still in use today. And he was the first surgeon in the world to do this. He also performed incredible surgical procedures ranging from plastic surgery, reconstruction of the nose and cheek, to hernia surgery, caesarean section birth, brain surgery, urinary stone removal, removal of the prostate, tooth extraction, cataract removal, treatment of wounds and internal bleeding, and many others. He further diagnosed and defined diseases of the eyes and ears, prescribed eye and ear drops, established the School of Embryology, developed prosthetic limbs, and advanced knowledge of the human body through dissection and the resultant understanding of human anatomy. One of his remarkable contributions was his ability to perform surgeries without anesthesia. Yes, you heard it right. He used intoxicants like wine and henbane to induce a state of mild intoxication in his patients. This helped to dull the pain and make the patients more compliant during the procedure. Sushruta recorded his knowledge in detail of surgical procedures, surgical instruments, and diseases in the form of Sanskrit book, which is called as Sushruta Samhita. He describes 60 types of upkarma for treatment of wound, listing over 300 surgical procedures and 121 surgical instruments in addition to the 1120 diseases, injuries, conditions and their treatments, and over 700 medicinal herbs and their applications, taste and efficacy, which are also dealt with in depth. To Sushruta, health was not only a state of physical well-being but also mental, brought about and preserved by the maintenance of balanced humors, good nutrition, proper elimination of waste, and pleasant contented state of body and mind. His magnum opus Sushruta Samhita stands as a testament to his brilliance. This ancient Sanskrit text not only shaped Ayurveda but also laid the foundation of modern surgery. Within the pages of the Sushruta Samhita lies a wealth of knowledge that transcends time. His pioneering techniques and skin grafts continue to inspire surgeons today, but his legacy extends beyond reconstructive surgeries and his treatise. He unveiled the origins of rhinoplasty or nose surgery through which he could reconstruct broken nose, a surgical artistry that aimed not only to enhance beauty but also to restore the essential function of breathing. His forehead flap technique was a marvel of ingenuity. In ancient times, the nose symbolized dignity and respect, but amputation was a common punishment. Sushruta's quest to restore the external nose birthed the science of rhinoplasty, forever changing lives and shaping the course of medical history. But his contributions did not stop there. His remarkable insights into orthopedic surgery astound us even today. From treating fractures and dislocations to advocating post-operative physiotherapy, his wisdom continues to guide orthopedic surgeons worldwide. His contributions etched in the Sushruta Samhita continue to inspire generations of healers. This Sanskrit script explains the procedure of surgery and is one of the 3 pillars of Ayurveda as well as a chapter in the Atharva Ved. The script explains how Sushruta performs surgery, the dissection of dead body, and examine them without a knife. Plastic surgery and dental surgery were practiced in India even in ancient times. Students were properly trained on models. Sushruta attracted a number of disciples who were known as Sushrutas and were required to study for 6 years before they even began hands-on training in surgery. They began their studies by taking an oath to devote themselves to healing and to do no harm to others, very like the later Hippocratic Oath from Greece, which is still recited by doctors in the present day. After the students had been accepted by Sushruta, he would instruct them in surgical procedures by having them practice cutting on vegetables or dead animals to perfect the length and depth of an incision. Once students had proven themselves capable with vegetation, animal corpses, or with soft or rotting wood and had carefully observed actual procedures on patients, they were then allowed to perform their own surgeries. He was one of the first people in human history to suggest that a student of surgery should learn about human body and its organs by dissecting a dead body. These techniques, preceding present-day workshop by more than 2000 years, are some instances of his experimental teachings. These students were trained by their masters in every aspect of the medical arts, including anatomy. Since there was no prohibition on dissection of corpses, as there was in Europe for centuries, physicians could work on the dead in order to better understand how to help the living. Sushruta suggests placing the corpse in a cage to protect it from animals and immersing it in cold water such as a running river or stream, and then checking on its decomposition in order to study the layers of the skin, musculature, and finally the arrangement of the internal organs and skeleton. As the body decomposed and became soft, the physician could learn a great deal about how each aspect functioned and how one could help a patient live a healthier life. This method helped Sushruta invent complex surgeries like cesarean, abdominal surgeries, or brain surgeries. He also prescribed measures to induce growth of lost hair and removal of unwanted hair. Sushruta was very famous for even cataract surgery and even treated many eye problems. It's written in great detail in one of Sushruta Samhita's volumes called Uttar Tantra. This process looked like the extracapsular lens extraction to modern surgeons. But Sushruta performed this surgery without modern equipments, which defines his skills. Sushruta Samhita was written in 600 BCE. Sushruta wrote the Sushruta Samhita as an instruction manual for physicians to treat their patients holistically. Disease, he claimed, following the perspex of chakra, was caused by imbalance in the body, and it was the physician's duty to help others maintain balance or to restore it if it had been lost. To this end, anyone who was engaged in the practice of medicine had to be balanced themselves. Sushruta Samhita remained preserved for many centuries exclusively in the Sanskrit language. In 800 AD, the book was brought before the world in the form of Arab translation, and it was called Kitab Shah Shun al-Hindi and Kitab Susurat. At the beginning of the 19th century, Hessler translated Sanskrit script into Latin and Müller in German. In this way, Sushruta Samhita and its author sage Sushruta received worldwide recognition, but with time, his name and importance dissipated. In 1907, Kolkata Kaviraj Kunjalal translated Sushruta Samhita into English, but the translation did not receive enough recognition. In the 20th century, when the world started looking at Ayurveda from a new perspective, they realized the importance of Sage Sushruta's medical science and its contribution to surgery. Sushruta Samhita is believed to be one of the gems of ancient Indian medical literature. One of the manuscripts from the Sushruta Samhita, written on palm leaves, is kept in the Los Angeles County Museum of Art. Sushruta gave a new meaning to the art of surgery in medieval India. The year 620 BCE is known as the Golden Age of Surgery. In 2018, the Royal Australasian College of Surgeons constructed a statue of Sushruta in their campus. Inspired by Sushruta's incomparable knowledge, American surgeon Alan Ripple said, "All in all, Sushruta must be considered as the greatest surgeon of the pre-medieval era. He became famous all over the world because of his work, but he also developed the Indian medical knowledge much more compared to others." Sushruta's holistic view of healing, with an emphasis on the whole patient and not just on the symptoms presented, should be familiar to anyone in the modern day. The recent practices and policies are considered innovations when compared with those as recent as the mid-20th century CE. But Sushruta had already implemented them over 2000 years ago. With that, we almost come to the end of today's episode. As I was preparing the content for this episode, I noticed most of the detailed articles on Sushruta was written by or sourced from books of foreign authors. I have two questions to ask before we wind up. How famous was Sushruta in India? What is the status of Indian medicine in India today? Do let me know on what you feel by writing to me at sush.entails@gmail.com. Thank you.